It's an overwhelming feeling. Very excited about it when I heard.
A moment of relief finally came for Kerian Burnett, a migrant worker who was granted health care after months of fighting to stay alive.
I've had sleepless nights. I cried night, I cried day. There are times when I speak about it and I'm okay, and another time when I just break down because of what I've been through.
Burnett arrived from Jamaica to Nova Scotia in 2022 under the Seasonal Agriculture Workers Program. She was diagnosed with cervical cancer after 2 months of work and was subsequently fired and left without medical coverage.
I am just asking for help, whoever can reach out to help.
In December 2022, Burnett had exhausted her options. Even in the face of a crippling illness and possible deportation, she fought to stay in Canada for treatment.
She was able to receive some coverage during that time at the discretion of the hospitals. But we're very thankful and very happy that the federal government has decided to approve this case.
In Ontario and Quebec, migrant workers employed under the Seasonal Agriculture Workers Program are eligible for public coverage, but not in Nova Scotia. A local migrant advocacy group says Burnett's case should set a precedent.
So we're continuing to advocate to the Nova Scotia government to ensure MSI for all migrant workers on arrival and everyone regardless of immigration status.
Burnett will have health insurance for the remainder of her temporary resident status in Canada, which will last until January of next year. She says she is focused on recovering from complications during her surgeries and being strong for her 6 kids and especially for her 5-year-old granddaughter.
Sometimes I'm there and I'm like, really sad, and I would call her and she would answer, and she'd say, "Granny, I love you so much." That's one of the main reasons why I fight.
Vanessa Wright, Global News, Halifax.